Finally, the chairman's bill is most likely within the jurisdiction of the Armed Services Committee because of the heavy role contemplated for the Department of Defense and the financial liability placed on the TRICARE program. This bill is at heavy risk of Rule 25 point of order on the floor, and we've been given no assurances from Chairman Lejeune or Ranking Member McCain that it's in any way acceptable. So, where are we? Two separate bills, Chairman's mark, one dealing with the homelessness issues, the amendments of Senator Tester and probably Senator Sanders, and it will move. And the committee, not with my support, will move a bill that basically sends this population off to some imaginary TRICARE program that the Department of Defense will never recognize, that the Committee of Jurisdiction will never sign off on, and these folks are in no different position than they were before we started this markup. But we knew that. That's why we set it out as a separate bill, because nothing was going to happen to it. It wouldn't go anywhere. The committee wouldn't consider it, and we could wash our hands of it and say we've done our best. We've punted this ball down the road because we've determined it's not our jurisdiction. Yet the precedent of prior exposure is in fact the jurisdiction of the VA committee, not the Department of Defense. So, what I would ask my colleagues is this the jurisdiction of our committee? If you don't believe it is, then vote against my amendment. If you believe it is, then I have amended it to the homelessness bill so we assure that it goes together. It doesn't assure that it's going to end up on the floor together. I'm sure there's some conversations that we're going to have before then. There might be changes to the bill. But let me say very candidly, negotiations took place before we got here. Negotiations broke down because it was unacceptable for me to put the hands of these people in the Department of Defense. And we couldn't bridge that gap. So this is left up to the members. Individually, not down the center of the aisle, but individually for your own determination as to whether the United States of America and the United States Congress have an obligation to these people. If we do, then by golly, let's give them health care. If we don't, then kick the can to somebody else. But don't think that by immaculate conception, health care is going to appear to them. They're going to continue to take it out of their pockets. They're going to continue to get less than the care that they probably deserve because they will go and seek that care in an outlet that doesn't understand how to treat exposures of the kind that they have been exposed to. So, in summary, the chairman's bill gives family members false hope. If you support my amendment, you will give them real hope. You won't give them coverage. We're not there yet. But you will give them some hope that this Congress is willing to stand up and fulfill what I think is an obligation we have to them. Mr. Chairman, I yield.